Thanks everybody for being here with us today. Lauren, if you want to advance to the next slide here, we'll do introductions in just a moment, but I want to let everyone know that we do have medical review board that reviews this material as it gets created. So Dr. Brandon Nettle was kind enough to review our mental health slides for us. You can go ahead. So I'm Kelly Hendershot. I'm the Vice President of Partner Relations at Cancer Support Community. I'm a social worker by background. I've been with the headquarters team for about 3 years now, and I think this is my second or third time being a speaker for GRIT, so it's always nice to be part of this conference. I was online this morning attending some of the sessions, so it seems to be going really well. I'm also have a history of being a caregiver. My husband died from cancer in 2009. He had terminal brain cancer that was inoperable. So I really have a passion for what the caregivers are going through. And you'll hear a lot of that as I'm sharing my slides today. But I'll let my colleague Lauren introduce herself.
Hi, everyone. I'm Lauren Burling, and I am one of the community navigators here at Cancer Support Community. I became a full-time staff member with Cancer Support Community actually just a few weeks ago, but I've been working with them as a contractor for some time. And in my most recent position, I had created embedded mental health clinics in cancer clinics in actually the Finger Lakes region. I'm a social worker as well by background, and my passions are in mental health and socioeconomic health equity disparities in cancer care. It was multiple things that led me to social work and to working in oncology. One thing especially that led me to this work was the work by Viktor Frankl. So if you've read his book, Man's Search for Meaning, many of you may be familiar with that work, and it really speaks to why I do this work. So thanks for having us today.
All right. Thanks, Lauren. So we don't have any relationships that we need to disclose other than we can both say that we're fans of Grit Health and supporters. Lauren actually lives in Rochester, New York, where a lot of the Grit Health staff is located. So we're hoping to get them connected in person. But our mission at Cancer Support Community, and if you've heard us speak before, you'll notice that this mission is slightly different. We changed our mission statement to give it a little bit more accuracy this year. So what our mission is to uplift and strengthen people impacted by cancer by providing support, fostering compassionate communities, and breaking down barriers of care. You might be familiar with the name CSC. You might be more familiar with Gilda's Club. It just kind of depends on where in the country or in Canada you live. We do operate at 190 locations. That includes network partners, like our CSC at Gilda's Club Rochester location, for instance. We have a lot of hospital partners and other healthcare clinics that we partner with. In total, we have an active presence in 31 states. We're working to grow that. One shared province in Canada, in Japan, Tel Aviv, and Baghdad as well. So you can go ahead, Lauren. So here's what we're going to be talking about today. Why does mental health, what is it, and why does it even matter? To do that, we're also going to cover some emotions and feelings that are tied to mental health. We're going to tie mental health directly to cancer. And then we'll have a few subsets. We'll talk about survivors, caregiver perspective, and then some additional care options and ongoing self-care. That ongoing self-care is always really important, no matter who you are and how you're impacted by a cancer diagnosis. And I'm going to go ahead and ask that we bring up our poll. We just want to make sure that we get a good feel for who we have in the audience today. So you can see the poll here. It's just asking, what is your experience? You might have more than one. Just choose whatever the most relevant is at this time. If it's yourself, as for caring for a family member. And there is an option to scroll down if you can't see them all on your screen. This just helps level set things for Lauren and I as we're talking and to know what our audience looks like. So it looks like we've got a really great mix in the responses I'm seeing so far of people with the diagnosis, survivors, and caregivers. A lot of advocates on the call too. Okay, I think we can go ahead and end the poll and share. I don't know if we need to share the results.
Looks like I can pop those up.
There they are. So again, you can see a nice little mix of who's attending, which is helpful to us as we know who we're talking to. Okay, next slide.
Let me just get that poll screen down. All
I'm
right.
turning things to Lauren.
Thank you so much, Kelly. And wow, thank you for sharing about how you identify. It really does help. And it really just goes to show how cancer has touched everyone in some way. And so hopefully today's call is helpful to you for many different reasons, but also helpful for people in your life. So what is mental health? Why does it matter? Why are we talking about this today? So just a brief overview. When we think about mental health, we can name this as a combination of how we think, how we feel, and how we connect with others in our lives. It's a combination of our psychological, our emotional, and our social well-being. So it's really normal to have ebbs and flows in your mental health and your emotions across time. Our emotions can change from day to day. They're never constant. One thing I wanted to name as we start talking today is that sometimes when we're talking about emotions and feelings, we think of emotions as being a negative. But I want to invite you to notice that feelings and emotions can both be positive or perhaps negative. Notice how we're frequently naming our emotions as good or bad. And notice as we talk today, if you can start to let go of any judgment about how you're feeling, judgment or stigma about emotions you might be having. So I would argue that mental health is arguably as important as our physical well-being. Our mental health impacts our mood. It influences our motivation to participate in our life, to be active and productive. It can really influence our ability to do what we need to do on a daily basis if we're not tending to it. Caring for our emotional well-being. It allows us to do the things we need to do in all areas of our life. You might notice that when you're not feeling as well emotionally, it might be harder to do simple things on a day-to-day basis, like prepare meals, visit with your friends, take care of daily living tasks like paying bills, doing laundry, etc. And it can be all the more difficult because sometimes we don't understand why we're feeling a certain way. So I'm going to be going through some examples of factors that affect our mental health. I want you to think about factors that might affect your mental health as I'm clicking through here. And you can replace the word factors even perhaps with the word trigger. So these are just a few examples of situations that you may have experienced that might impact your mental health. And this list is not the end all. There's many things probably missing from here. School or work responsibilities, needing to have difficult conversations, facing a serious illness such as cancer, which is what we're talking about today, maybe having large bills, needing to pay off debt, moving away from your community, feeling isolated, experiencing the death of a family member or a friend, tight deadlines. Oops, I'm going to go back really quickly. There's a few things that I noticed on here I wanted to add as well. And if you have specific examples of triggers in your life that you want to add to this list, feel free to drop it in the chat. What about restful sleep or appetite changes? Losing a pet too, I really wanted to add to this list since our pets can be such a huge part of our lives. And anything in your life that might be hanging over your head, these might be things that might impact you on a daily basis. So think about when you have felt good about your mental health or just feeling really balanced overall. You're welcome to just kind of think about the answer to this question as you sit here with us today, or you're welcome to jot it down or even put it in the chat. Um, Consider what it was about you feeling good that day that made you feel that way, right? So sometimes there's factors that affect us in a good way. Um, and then on the other side, think about a time where you maybe weren't feeling your best recently. What was it about that day that caused you to feel that way or that event? Was there a specific event or person or thing happening on that day that made you feel just not so great? Sometimes we can figure out what's causing us to feel a certain way, and sometimes the source is unknown or it feels like it just kind of came out of nowhere. So let's talk about why it's so hard to talk about mental health. Because mental health can be such a difficult thing to measure, it can be really difficult to describe. And as such, it can be difficult to know when we need more support or professional help. And this is where we get to this idea of stigma around mental health, that this is a really difficult topic to talk about. And as such, it can further stigmatize people getting help. These are just a few examples around some stigmas that people might experience. Perhaps from a cultural perspective, it's not always, people don't feel very comfortable seeking support. People might feel ashamed to talk about it. It's not something you can see like physical health. So thinking about that idea of it's not something we can measure, right? We can't take a measure of our mental health like we do our blood pressure or other means. We're starting to, if you've been in your doctor's office, you might have filled out some paperwork about your mood. So we're really trying to be able to capture that so that we can help people faster. But really, measuring your mental health requires getting in touch with what you're feeling, being able to share with others, and letting go of judgment about what you're experiencing. So a few other examples of what stigma might look like. So this is a rhetorical question, but you're welcome to answer in the chat. Has anyone ever said to you, just look on the bright side, or it could be a lot worse? Just choose to be happy. Statements like this can be very invalidating to someone's experience, and it can make someone feel worse about having difficult emotions. It can make you question whether what you're feeling is worthy of seeking additional help. Talking about emotions can actually be thought of like engaging a muscle that's underutilized. The more you practice sharing what you're going through, the easier it will feel to describe and could over time help lessen stigma. I wanted to also name that some less obvious stigmas in our society could be things like our insurance coverage, having lack of coverage for mental health care, having high copays, having difficulty finding someone in network, or having difficulty finding someone accepting patients. This can all further the stigmatized nature of finding mental health support. So, we really want to normalize mental health. We really want to normalize the idea that there is a huge range of spectrum that people feel with their emotions. And there's a really wide range of how people might choose to share about what they're feeling. And whatever you choose to do is right for you. Some people might choose to keep their experiences of their emotions and mental health very private, while others may choose to be very open about what they're experiencing. Sharing about what you're feeling or have felt in the past might give others permission to share openly about their experience as well. But also recognizing that if you're keeping that private right now, that's also an okay decision to make and that's personal to you. So let's talk about it, right? So someone or everyone may often appear that they're doing really well, but on the inside, they might be struggling. I don't know if anyone's ever heard this saying before that just because you carry it well doesn't mean it isn't heavy. So people can sometimes really mask how they're truly feeling, which makes it difficult to understand how prevalent mental health concerns can be. And this can just further lead to feelings of isolation and sadness. So that was a brief but somewhat thorough overview of mental health, I hope. And now talking a little bit more about emotions and feelings and moving really into breaking down the important words within mental health that can be a really helpful first step to understanding our own mental health. I would love to get some reactions from the group, either by using your hand in Zoom, or even just if you're on camera, you can just raise your hand. I want everyone to raise your hand if you are someone who is always in balance. So it's kind of a trick question. I don't know anyone who is always in perfect balance, right? I know that we're typically always off to one side a little bit. Um, and that's normal, right? So we all experience some normal everyday ups and downs. Um, and being emotionally balanced all of the time um, is just it's really hard to do. Sorry, I just got a sign that my battery was low, so I had to plug it in. There we go. We're safe. Noticing too that emotions, when we do get out of balance, it doesn't always mean that it's a problem for you. You are the one that identifies whether a particular emotion is challenging. And those problematic or challenging emotions can only be identified by the person feeling them. But sometimes the caregivers in our life can make observations as well about how emotions might be impacting the family as a whole, especially if things are really getting off balance for a long time. I wanted to move a little bit into when those emotions and feelings get out of balance a bit more. Let's talk about when emotions and feelings give way to actual mood concerns that begin to impact your daily life. Sometimes when we begin to experience a mood concern like anxiety, it could be a sign that we might need additional intervention or help. Anxiety is a feeling of uneasiness, worry, or fear that usually occurs because of stress. Sometimes we're anxious for a really good reason, and sometimes we experience anxiety that may not have a root cause or may not actually be in alignment with reality. Grief. So, grief is a really normal emotional response to a challenging and disruptive time. Grief can be a concrete loss of a person, loss of health. It could be feeling of losing control. Grief can even include grieving future losses, like missing events, anniversaries, or opportunities that you were looking forward to. So how do we know if we're feeling like we're just having normal emotions, or if we're moving into stress and a distress response? So stress is a state of feeling overwhelmed, either physically, mentally, or emotionally. And it can occur from all sorts of different things, but it could be an event, trauma, an illness. And it might be hard to notice that we're feeling stress because it can happen over a period of time and it can be really gradual. For me, I know that one of the hallmark signs of having too much on my plate is beginning to feel really irritable or tearful. It looks different for everyone, but that's just an example for me of when I start to notice that I'm feeling super stressed and I need a moment to step back. So if as we're talking, you're noticing that what you're experiencing right now today or in the global last couple of days doesn't really align with the terms I'm using, know that that's also okay. Emotions can only be identified by the person experiencing them. And you might be experiencing a level of some of these things or even a combination of some of these things. And they may not necessarily be problematic for you, and you might even be coping quite well. Depression, right? So it's not unusual to have feelings of depression or anxiety after receiving a cancer diagnosis. Additionally, it's not uncommon to feel a level of stigma around depression. The statistic is about 27% of people who are diagnosed with cancer will experience depression at some point during their treatment or in survivorship. Depression can be a really complicated term, right? Because there's the normal stress response to a new diagnosis, there's normal stress and distress, and then we get into depression when it's persistent, when it's affecting your daily life, when you start to lose interest and pleasure in doing things that you used to enjoy doing, perhaps feeling worthless or feeling hopeless. Maybe you're having a change in eating or sleeping habits. These are the hallmark signs of depression. And this is really when we start to notice that like normal expected emotions and stress responses start to move into something a little bit more concerning. So if you or someone you know is showing these signs, what we would want you to do is connect with your provider or mental health professional. You can get screened for depression. And at the end of the presentation, we're going to get a little bit more into specific resources. But on this slide, we do have just a quick info about our helpline, which if you were to call our helpline today, I would be one of the people that would answer. Just as an FYI, you can call 988 or you can call a local Gilda's Club, but we'll talk more about that as we go on. So again, similar to stigma about mental health, a diagnosis of a mental health illness may carry its own stigma. So when emotions or feelings start to become prolonged and exist over a period of time, this is when we start to get concerned that it's actually a mood disorder or a mental health illness. And this is really when, again, you would want to be properly diagnosed by a professional. I would be amiss if we didn't spend a moment talking about the importance of recognizing suicide ideation in a presentation about mental health and cancer. It's not uncommon for people that have a cancer diagnosis to at some point in their diagnosis or treatment trajectory to think about thoughts of dying. But this is not the same as suicidal ideation, and this is important to distinguish. Suicidal ideation is when someone is having serious thoughts about harming oneself with the goal of ending one's life. Signs can be withdrawal from loved ones, mood swings, thinking more about self-harm, impulsive behavior, or even starting to create a plan around this. The best and fastest way to get help is to go to an emergency room or to call 988. Okay, so I just want to make sure we spend a moment talking about that as we move forward with today's talk. Just going to spend a moment on this slide before I hand things back over to Kelly to really integrate what we're talking with mental health with how it affects you in the context of a cancer diagnosis.
Okay. Thanks for that, Lauren. And over the next several slides, we're going to discuss 3 different stages and how each one of them is unique and can influence your mental health. The first is going to be at diagnosis, the second during treatment, and then the third is active treatment. After active treatment, I'm sorry, or chronic treatment. So next slide, please. Mental health is, it's really a concern for a lot of people affected by cancer. So the person with the diagnosis, the family members, friends, coworkers, and it really should be treated and supported just like we do our physical health. Our helpline navigation at Cancer Support Community, for instance, is free. It's an available service to all individuals affected by cancer. And the helpline staff, like Lauren, is it's staffed by navigators who specialize in various fields and who work together to deliver individualized support and navigation services. So just in a single year, our helpline saw a large volume of calls related to mental health from both patients and caregivers. One important point that I want to give from this data is that caregivers experience similar areas of stress as seen by patients. This really highlights the role that caregivers play and also the need for mental health support for caregivers. When my husband was diagnosed, I went to our local Gilda's Club. This was in Iowa at the time because I thought he needed support. He said later that he went because he thought I needed support. Clearly, we both needed it. So we were both had a lot of stress and mental health issues that we needed to address. And we got that by going to support groups. So learning how to reduce stress and other mental health symptoms, it's just really helpful to you for your well-being, regardless of who you are in a cancer diagnosis. Next slide, please. All right, so these are very high percentages that you're seeing on the screen here. 78% were worried about the future. And these are patients, let me clarify. 60% felt fat, sad, or depressed. 64% felt nervous or afraid. So when we get calls like this, the helpline can assist patients, caregivers. The numbers up there on the screen, 888-793-9355. And I'm going to be talking a little bit more later about how we provide that support. Let's go to the next slide for now. So receiving a cancer diagnosis, we all know how difficult that is. It can bring different emotions. It's really hard to handle. Your care team, your loved ones, they might ask you how you're feeling, right? You know, how annoying does that get? How are you feeling? I try to specify it to how are you feeling right now, because we know how much that can ebb and flow throughout a day. And it's really important that we trust and be honest with them about our emotions surrounding the diagnosis and what lies ahead. And I realize that is difficult to do. It puts you in a vulnerable space, but we do need to make sure that we're taking care of ourselves. And I just noticed a chat pop up. Yes, we do have helpline support in Spanish. Lauren can talk about the language support in a little bit here too. So next slide, please. So I just want everybody to think, and if you want, you can place your responses in the chat, but think about what new emotions have you experienced since receiving either your own cancer diagnosis or a loved one's diagnosis. And any emotion is fair game. We want you to be honest. Everybody reacts differently to stress. Some people can cope, some people need to deny. Sad, helpless, angry, overwhelmed. These are all great. Another angry, numb. Oh, perfect. Yes. I remember those feelings. Panicked. And it's important, you know, when you can name an emotion, it gives power to it. And I'm paraphrasing largely what Brene Brown has to say about that. But once you can name an emotion, you have the power to handle it, to cope with it, to move forward with it, which can be a very powerful thing. Let's go ahead to the next slide. All right, so can y'all resonate with some of the fears on the screen? Fear or worry? And again, it doesn't matter if you're the caregiver or the person with the diagnosis. There's that fear of the unknown. Somebody mentioned in the chat earlier, anticipatory grief is what pops up when there's fear of the unknown. Fear about how this can impact your job, your family, your finances, worry about your own health or appearance changes, fear about losing independence. I used to facilitate caregiver support groups at Gilda's Club in Iowa. And one of the things that would come up a lot is, well, I can't take care of my health. I'm too busy taking care of my loved one who has the diagnosis. And so it led to some really great conversations in support groups about how we're no good to our loved ones if we're not taking care of ourselves. We need to make sure that we have the energy for the toughest times. And every moment might seem difficult, but there are going to be more difficult times. So we need to take advantage of that self-care and focus on ourselves a little bit so we can be stronger, more supportive caregivers. Told you in the beginning, I have a passion for caregivers, so you're going to hear it throughout. So next slide, please. Anxiety. It's very natural for anxiety to creep up. So some things that you might feel anxious about is how to manage the treatment, the appointments, the travel time, how you're going to get there, who's going to take care of the kids while you're at treatment, what the future is going to look like. That's a big trigger with grief. In a cancer diagnosis. And grief is a reminder, grief isn't just with a death, that's bereavement. Grief can happen with the loss of anything. So you grieve because your future was going one direction. Now it's going another direction with the cancer. You might feel anxious about what to tell your kids, your friends, your spouse, your children. That's really the power of the support groups that you'll find other people have experienced these same fears, these same anxieties, and there's a lot of comfort in knowing that somebody has walked in your shoes as well. Let's go ahead to the next slide. sadness, loss of hope. Those are very common themes as well. They come up quite often in our support groups that struggle to understand, why is this happening? How did it happen? That, you've all kind of heard that saying, why do bad things happen to good people? That sadness about not overcoming a diagnosis or possible concerns about dying. One of my biggest frustrations with palliative care, with hospice, is people have a misconception that choosing palliative care, which is not hospice, you can get palliative care at any time during a treatment. It helps support quality of life. Or choosing hospice happens when you give up hope. And that, when I hear that, it always just makes me sad, because it doesn't mean you've given up hope. If you're doing palliative care, it means you're hoping that your quality of life will improve. If you ever get to the point where you're choosing hospice, your hope is that you'll have a better death, or that you'll have better time and quality with your family before your death. So our hope just changes. It doesn't end at any point. But that feel of loss of control of your life is such a common theme as well. Let's go ahead to the next slide. There's always those uncertainties about the next steps. Somebody mentioned earlier in the chat that scanxiety. How is this going to change my life? What's the side effects going to do to me? I kind of joke that I could never say this to normal people not impacted by cancer, but to my support group, I said at 3 o'clock every day, I had to avoid my husband because that's when his steroids kicked in, and he was pretty crabby. So there's that uncertainty with how we're going to deal with side effects, how we could potentially lash out, and how we could react if we're not taking care of ourselves either. And then just concern about overcoming the illness. There's been a lot of advancements in treatments. And so that is something that we're seeing more. People are living a lot longer with cancer too. Let's go ahead to the next slide. Right. So I told you that I was going to talk a little bit more about some of the actionable things that our helpline does. And one of those is distress screening. You've probably had this done at a hospital. A lot of times they might use a thermometer approach, but it's really important to complete some sort of distress screening, because it informs your care team of any current concerns you have and how they can better support you and serve you. With Cancer Support Community and Gilda's Club, and this is something Lauren does on our helpline as well, we have a questionnaire, and it lets us know if there's any key areas of concern for anxiety or distress. But most importantly, it helps us get to know you so that we can provide you with the most appropriate resources for your situation. So you've noticed by now, there is no guidebook to cancer. There's no one-size-fits-all path. And so tools like distress screeners help us really individualize what tips, tricks, resources we're going to provide you with. So let's go ahead to the next slide. It's really important that you're speaking openly about previous mental health issues as well, too. Your doctors, it's important that they know if you've had medications that haven't worked in the past. If you struggle with mental health, anxiety for example, did you meet with a therapist, or have you received a mental health diagnosis before the cancer? Make sure you're sharing that with your team, because again, different side effects for mental health can interact with some of the side effects that you might be experiencing with treatment. So it's all about providing the best support possible. When your doctors are asking you mental health questions, they're not inferring that you're crazy, that you have any problems. They're just trying to get to know you better so they can make sure that they're treating you properly. Let's go to the next slide. There's always that what next, that feeling like we're juggling so many things. And, at some point we're going to drop the ball, right? So adding in a cancer diagnosis to your life, it can seem impossible to handle everything given your other responsibilities. You can see on the screen, there's the work, the finances, school, struggling to cope, children or other caretaking. Things are just moving too quickly. How often do you feel rushed to make a decision about treatment? So there's a lot that you have to organize and manage. Speaking with your care team about your other life challenges or responsibilities is really important because stress, it's just really important that speaking to a care team on a regular basis is going to help because you carry so much stress with you. They can help you manage that as well. Next slide, please. So who do you talk to? There are several different people that you can help talk to and get support from throughout the course of your treatment. And I'm not going to read all the descriptions of people on the team, but there's your oncology care team. The oncologist, he's the one calling most of the shots. Some people refer to the oncologist as your quarterback on your team. The nurse or nurse practitioner, these are the ones who are making the medical paths and options for you possible. Patient or nurse navigators. I heard in one of the presentations earlier today that the navigators are kind of like bullies on your behalf. They'll find you the resources and support that you need if you let them. I see Lauren laughing at that. Maybe that sounds familiar to her or she can relate to it. But let's go ahead to the next screen and start talking about some more of these options too. So there's the licensed social workers. That includes Lauren and myself. We provide support by finding resources. Many of our CSC and Gilda's Club locations will provide short-term therapy related to the cancer. And we can help you find counseling resources as well. There's licensed therapists or psychologists. So therapists, psychologists, a really big difference between them and social workers is they can prescribe medication, the psychiatrist can. Psychologists are going to provide long-term therapy, sometimes individually, sometimes in a group setting. But it's possible to find some psychologists and psychiatrists that do specialize in cancer as well. Chaplains at hospitals are great for spiritual support. Seek out your faith-based community for additional help and guidance. Community supports. I'm going to keep repeating. You might have a Gilda's Club or CSC in your community. My local gym was a great support to me as a caregiver. They would help be there for me as I was trying to get workouts in, things like that. Let's go to the next slide. So there's a lot of things that you might encounter regarding your mental health during treatment. With any treatment you're given for your cancer, you want to make sure that you're always informing your healthcare team when you experience any new or changing emotions or feelings related to your mental health. So an example could be that you're noticing you're more agitated than usual about tasks or situations. In my example I gave earlier, my husband got really crabby at a certain time of day from his steroids. But that his mental health, he didn't like how he treated me. And with my mental health, I didn't want him to blame him for his actions, but it could be frustrating for both of us. So a lot of times cancer treatments can cause side effects that impact the mental health, our physical health, and our functional health. Your care team is really going to know what's best for you if they're aware of changes and side effects that concern you. So even if you're beyond treatment, make sure that you're continuing to regularly check in with your care team about how you're feeling. Next slide, please. And again, there's a lot of different support options that are available to you. Some people are looking for very specific supports, though. That could be your specific type of cancer or stage, could be the phase you're in, whether you're active treatment, you're in survivorship, you're post-treatment, or other demographics. We have a growing amount of young adult groups, for instance, across our network. We also have LGBTQI plus specific groups for different needs. Let's go ahead to the next slide. So support options after diagnosis and after treatment. Many of these you saw on the slide earlier. So there's that one-on-one therapy option. with a licensed therapist, I'll point out, or psychologist, social worker, somebody to discuss these general concerns. So therapy sessions, they can last 60 minutes in general. You can meet as many times as you're like, or unfortunately, as your insurance will allow. And a lot of times this can be done both in person or virtually. Group therapy is usually led by a therapist or a psychologist. It's done in a group setting where a lot of the participants have similar needs or can benefit from the support of each other. Support groups like we offer at CSC and Gilda's clubs, they offer support. Ours are professionally facilitated, where we do have a licensed mental health professional in the room. But they're really helpful in making sure that you don't feel like you're alone, that other people have gone through what you've gone through. I walked into my support group for the first time. I think I was 28 or 29. Everybody in that room could have been my parent or my grandparents' age. And I'm like, this is not going to work. It did. It was so great for me. You know, we say that Justin had terminal cancer, but Gilda's was our lifeline because we got to focus on living and not on the terminal part. Yes, a lot of these support groups are free. Anything offered at a CSC or Gilda's Club is going to be free. There's also a lot of peer-to-peer mentorship programs, a lot of great organizations like Immerman Angels, Cancer Help Network. They're going to provide more of a peer support where they partner you with somebody in a similar situation. There's helplines. Ours is on the screen, which again is free. We do provide language support in up to 200 different languages. And of course, community resources, your faith-based resources. I shared the link in the chat earlier to find a CSC or Gilda's Club near you. So I'm going to thank you for putting the Immerman Angels link in the chat. I'm going to turn things back to Lauren to talk about survivorship for a bit.
You so much, Kelly. Kelly just mentioned again our ability to use other languages on the helpline. We actually have of our staff support, at least 40% of our navigators on the helpline are Spanish speaking. So we do have Spanish speaking navigators directly. And if and other than Spanish, we use a service to make sure we can connect with people in their preferred language. So going into the survivorship, survivorship, many of you may be familiar given our group here today, but it's that point that you reach when all of your active treatments have been completed or have been completed for now. So you might still be prescribed medications that are helping with long-term management or for your side effects from your primary or active treatment. And so whenever we get into the survivorship stage, you know, I'm just wondering how that felt for you, if this applies to you when you were finished with active treatment, which we define as surgery, chemotherapy, or recent radiation. These are just a few examples of emotions you might have experienced or that your loved one may have experienced: relief, cautious optimism. But oftentimes we also experience the opposite emotions like fear that it might come back, concerns about the future, not knowing what's going to come around the corner next. And I often hear from people that it's harder for them when they get to survivorship because they're not doing something, and that kind of active treatment made them feel as though they were doing something about the cancer on a daily basis. So that can be a really tough transition. Anxiety, somebody mentioned this earlier. This is a term that we use to describe anxiety as it relates to upcoming scans, right? So can also be seen during the survivorship phase as you are having less frequent contact with your care team, but maybe you have different points over the course of months or a year where you have different appointments or scans scheduled. You might have like a 3-month scan or a 6-month scan. And as you get closer to those dates, you might experience more anxiety leading up to those scans or anniversaries related to your annual checkup. And that gets back to this idea of fear of the unknown, being afraid that there's something happening that you're not aware of. And one thing that I would just like to share with everyone here is this little phrase you can put in your back pocket, that thoughts are not facts. So sometimes when we experience anxiety, we think to ourselves, like, oh, there must be a reason why I'm feeling this way. And it can be really important to challenge that belief. And that's something that therapy and group therapy and support groups can help with, is just checking the facts and really staying in the moment with what you know about your diagnosis on a day in and day out basis. So during survivorship, like I said, you might feel less connected to your care team. You won't have appointments as frequently, which is really normal. If you start to feel a little bit more anxious, the further you get away from active treatment, again, bring it back to your care team. Let them know how you're feeling. Many oncologists or nurse practitioners are happy to talk with you or to assure you that everything is fine. And it's important to continue finding support in the survivorship stage and to find activities that help you manage and cope with your emotions and to start to integrate kind of who you were before cancer, right? And to continue doing the things that you love and that make you feel really balanced. I love this one about practicing healthy sleep habits. I have a 5-month-old right now, and we're just getting to the other side of being able to sleep through the night. And having not slept for so long, I can just tell you that being in a state of sleep debt or sleep deprivation can really have a profound impact on your ability to cope in all areas of your life. So something we call sleep hygiene is figuring out like what you can do in your environment to make sleep just a healthier and easier thing to access. Maybe sleep masks, sound machines, blackout curtains. I could go on and on. I've tried it all. So getting back to your new normal, transitioning back to life after treatment brings new challenges. Similar to when you start receiving support at the start of a new cancer diagnosis, it's important to start receiving support here as well, and letting people in your life know about this transition and kind of what might be helpful as you get back to your new normal. Okay, so let's talk about what happens if there's a relapse, a recurrence, or a metastatic diagnosis. This is not something that anybody wants to hear. And being told that your cancer has come back or that your cancer has progressed or that it has spread is very difficult to hear. When you start to live with an advanced cancer, your challenges change, right? You start to have unique challenges that you didn't have before. And it's very hard when some of those fears and anxieties you might have had in the past became affirmed with this recurrence or progression of disease. So seeking support, you know, continuing to connect and to communicate what's going on for you with your loved ones or with your care team, and figuring out who those safe people in your life might be. Sometimes we are surprised by who our support people are during a cancer diagnosis or any challenging time in our life. And it's okay to recognize that somebody may not be the best support person for you. Maybe there's an immediate family member that needs their own support while you're going through this, and you can't maybe have that support from that person. But noticing and staying really open about what support looks like and connecting with the people that really make you feel good. Your oncology team, obviously, or your primary care team are going to be great resources for finding support. More and more oncology clinics and primary care departments are embedding therapists and clinical social workers in the offices. There's a lot of new models of care where therapy might even be available directly in your clinic with your internal medicine doctor or with your oncologist. So mention something to them. They may actually have resources that they haven't shared with you. So definitely speak up. And again, peer mentoring, there's a lot of great programs out there where you can get connected with someone who's maybe of a similar age as you or has a similar diagnosis. So at this point in our presentation, I want to pause. I just want to take a moment, just 1 minute, to check in with how our bodies and our spirits are doing. I want to invite you to notice how this conversation is landing with you today. I want you to notice what it might be bringing up. So wherever you are, you don't have to do anything special, but just take a moment and land in your seat. If you're comfortable closing your eyes for about 30 seconds with me, please do so. Notice your seat in the chair, your feet on the floor, your hands in your lap. Maybe relax your shoulders down your back. And I just want you to notice. Taking a few moments to rest and notice your breath. Notice any conversations you might be having with yourself as we talk about something really difficult today. And bring up memories. Notice if this conversation has brought up any thoughts of judgment about emotions you've had in the past, about ways that you've been feeling. And notice if you can give yourself a little grace. You can let go of that judgmental voice that tells us we should be feeling or thinking something other than what we feel. Your emotions matter. I invite you to stay here for as long as you'd like and continue just noticing your breath as we continue talking. We have a few more things to go over, so I'm going to keep moving forward and pass it back to Kelly. But again, if this feels really good for you right now, just stay here, noticing your breath, and just listen as we go forward here. Passing it to you, Kelly.
So, caregiver mental health, we're going to be talking about a lot of the things that we've already talked about because caregiving is difficult no matter the reason, health condition involved. If you're a caregiver, there are resources for you as well. So next slide. And again, you're seeing some pretty high numbers on the screen here. I said that too when we looked at the patient numbers. But our helpline is there for caregivers as well. So caregivers, they're worried about the future. They feel afraid and nervous. They feel sad or depressed, and they deserve help too. Let's go to the next slide. You might feel burnt out or distressed as a caregiver since you're having to balance the emotion of someone else's health, your own health. And as a caregiver, it's important to take time to care for yourself and your needs. I know that's much easier said than done from personal experience. It's difficult to optimally care for your loved one, though, when your own health and energy aren't at their highest potential. Next slide. So caregivers tend to put their needs and health second when it comes to caring for a loved one. It's important to also make sure that you're caring for your own physical and mental health as much as you're trying to do the same for your loved one, though. The better you can care for yourself, and I know I'm starting to sound like a broken record, but the better you'll be able to care for your loved one. Some support options that exist for caregivers are also support groups, one-on-one therapy with a psychologist or a therapist, or services at your local CSC or Gildas Club. And we understand that you want to do anything and everything possible to care for your loved one. In doing that, though, it does come with feelings of being overwhelmed for caring for them, or if you're caring for is on top of your own life and responsibilities, I should say. So consider asking for help to add balance. It's never going to be perfect. We already talked about nobody has that perfect balance, but just to find a little bit more balance in your mental health and in your caregiving needs. Maybe that means asking somebody to pick up the groceries for you, having somebody watch the kids for you so you can take a nap. There's a lot of different things that we each prioritize. So it's remember to keeping our own quality of health in mind when we're reaching out for help. Like, what do we really need to be doing ourselves, and what can we ask for assistance with? Next slide. All right. So just think about if any of these apply specifically for you. And if you do, you can chat about it with others as we continue talking. But as a caregiver, you might also experience similar feelings and emotions: anger, worry, sadness. Your emotions are valid, and it's important that they're recognized and addressed. So next slide, please. We are very close to the end of the time, so I'm going to go over these a little bit more quickly if you want to go to the next slide. Just some reminders about support group options. There's different kinds of support groups. There's peer-led support groups at CSC and Gilda's clubs. They're professionally led, meaning we have a licensed mental health professional in the room. There is our Cancer Support Community Helpline. There's also the National Alliance on Mental Health, or NAMI. It's a really great organization. And that 988 helpline, again, is as well. Our helpline, so Lauren and her friends who work on the helpline, they also have a tip sheet that can help you find a therapist. And that's something that they often email out to callers. So I just want to talk about one more specific slide, and that is medication next. In addition to these support options, sometimes medication really is going to be the best answer to help you manage your needs. Sometimes it just gives you that little bit of an edge. So only medical professionals can prescribe medications. Lauren and I, as social workers, cannot. But speak to your oncologist or your care team if you've been wanting to take medications for your mental health, if you think it could help. A psychiatrist is a certified medical professional who specializes in diagnosing conditions and might be most appropriate for prescribing medications. So on the next several slides here, we've got a little bit that I'm going to give to Lauren for self-care. We will have resources at the end of this presentation. I just want to point out that you will get PDF access to these. So as we're running low on time here, I want to mention that. So Lauren?
Thank you so much. And yes, because we're short on time, I'm going to click through these, but obviously, what can you do to support your mental health? Stay active, and active is going to look different for every person. There's a term called behavioral activation, where the thing that is hard to start doing is also the thing that's going to help you feel better now in the moment and also help you sustain good habits. And then again, some of these things that you may not have done for some time, I'll keep clicking as I talk, might be hard to start again. Perhaps, invite somebody to do these things with you. Starting a new hobby or going back to a hobby you haven't been doing for a really long time can feel impossible to begin, but start somewhere. And then I also want to give you this phrase for your back pocket today, this idea of doing something to improve the moment you're in now. It doesn't need to be something as huge as going for a hike or going for a 10-mile run, but it could be something like preparing dinner with a loved one, or having a cup of tea, or just a real small moment, maybe walking outside your front door, maybe just petting your cat, things that are basic, but that we might sometimes take for granted as being real mood boosters. I'm clicking through and just giving some ideas here on the screen. Integrative medicine are great therapies to also consider. Asking at your cancer center if these are available. Acupuncture, yoga is offered at a ton of our Gilda's clubs. Almost all of them have some form of yoga or physical component. Aromatherapy, massage, music therapy, art therapy. And one thing not on this list that I'll mention is Reiki. Reiki is an energy modality that many people going through cancer treatment and beyond swear by to really help them with the side effects. And that can really be a good mood booster as well. Back to Kelly.
All right. As I mentioned, as you saw in the chat, there will be access to these slides in the coming weeks, I think Lauren said. So I don't know, Lauren or Jess, if we have time for questions or if we just need to wrap up. But thank you again for having us. It's always nice to be part of the GRIT conference.